So everything is interconnected, and all of us are aware of it because when we are in the clinics, we are using so many different concepts all together. And it also applies a lot to biomechanics. Biomechanics being the bedrock of doing braces, it borrows a lot of concepts from so many different aspects. So as an example, here you have some of the concepts. This is not an exhaustive list of all the biomechanical concepts, but these are heavily used in day-to-day orthodontics, even though many of us, including me, we don't realize at that point that we are using these concepts, but yes, we are. And purely from a clinical efficiency perspective, you'll get better and better the deeper you dive into those concepts, which will appear pretty huge, and it will appear like an onerous task to master them. And I'm in that process myself, but the more you understand them, the more you find ways of adopting or inculcating them in your clinical practice. As you guys go out to do orthodontics, you will get just better and better in terms of efficiency, in terms of how much amount of time you're spending on the chair with a patient, in terms of diagnosis and treatment planning. So these are important. I call them as the first principles of biomechanics. First principle basically means that these cannot be changed. No matter you like it, you don't like it, these apply. These are happening. These are taking place in your patient's mouth. Of course, we can do braces completely ignoring them. But what I believe is that when we do that, we are stuck in this situation where we don't see a lot of improvement in our clinical efficiency as years go by. I'm not saying you won't improve absolutely in terms of clinical efficiency, because other aspects like practice management, what stuff you're buying, all that will kick in and you'll get better. But as far as using stuff in the patient's mouth and how to move teeth better and in a more efficient manner, these first principles are immutable. They are happening all the time. And if you make them your friend, they would be pretty helpful in increasing your output. So just to give you an idea as to what we really touched upon in Biomechanics 1, we basically just discussed these two aspects. And well, they are kind of the foundation of all these first principles also, but they are just, as you can see, a small part of doing braces. Unfortunately, from my experience, at least what I've seen going to different universities, to different countries, that 95% of the places, we are basically relegating ourselves to just these concepts in terms of teaching biomechanics or using biomechanics. I've yet to come across courses or academic schools or CE courses that go deeper into these other aspects, or at least touch upon them in a way that it is useful clinically. So this is just to give you an idea about what we deal with in Biomechanics 2 out here. So what I'll do is I'll just touched upon what we discussed in Bio 1. As I said, please feel free to jump in and ask if there are any aspects you're not understanding. Okay, so force and moment. What is a force and a moment? A force is a vector quantity, and it has got these following 4 properties. Of course, we know it's the act of pushing or pulling an object. So it has got a magnitude attached to it, which is denoted by the length of the arrow that you draw. A force will always act at a particular point. So it has got a point of force application. It has got a line of action, which is dictated by the way you are attaching your chain or coil spring or whatever you use So this is the line, right? So this is the line of force action. And then of course, it will always have a direction, up, down, back, forward, or if you're measuring in terms of angle, that I'm applying a steep force, I'm applying a flat force. So these are the four properties of force. Now, what a force by itself it does, it will always make an object move in a straight line. So when you apply a force to an object, it should technically, I'm imagining now that only a force exists, it will make it go in a straight line. Now, we know that forces act at not necessarily, what I mean to say, the force not necessarily acts at the center of mass of an object. So as soon as you see a force not acting at the center of mass of an object, another vector quantity gets introduced called a moment. So a moment will cause an object to rotate around its center of resistance. So force is causing it to go in a straight line. The moment causes it to spin around its center of resistance. The quantitative aspect of moment is given by force times the perpendicular distance, not the distance from where you are putting the force to the center of resistance. So it's not in this fashion. You don't measure force like this. That would be wrong in terms of the distance that you want to you're trying to evaluate. You have to go like this. So when you combine a force and a moment together, you get the final movement of your teeth. And that's why when you apply a force like this on a tooth, the force is causing it to translate, the moment is causing it to rotate. And if you combine them, the tooth will spin somewhere around this. Maybe I'm drawing it slightly apical, somewhere around this part. Okay. Let me make a more accurate there. Okay. So it's a center of rotation that is created, which is generally 1 to 2 millimeters apical to the center of resistance for an incisor. This is well researched, well documented. All right. So there you go. That's the how a tooth will spin when you have both the force, which is creating a moment, is acting on a tooth. So there are some ways of creating different kinds of tooth movement. And broadly speaking, there are two basic pathways only. The first pathway is if you can change the point of force application, then you can create different kinds of tooth movement. And the second is the moment due to force that you saw in the previous slide. If that can be altered, so if this moment due to force can be counteracted by a different moment, then you can create a different kind of tooth movement. So these are the two different ways by which you can create different types of tooth movement. And of course, there are certain concepts associated with it. We will not go deep into that today as we are just doing a quick recap. But important concepts to keep in mind are starting from order of priority, equilibrium, key, and then the MF ratios, or better, the MF by moment due to couple ratios. These are important. Equivalency is something that is important to know, but I would place these two concepts above equivalency. So looking at the first way of changing the tooth movement by altering the point of force application. These are consecutive pictures that kind of shows you how by changing the force levels, you can create different types of tooth movement. So this is a force at the bracket. You get this characteristic uncontrolled tipping. This is the definition of uncontrolled tipping. That is when you apply a force right at the bracket and you have no other force applied to it or any kind of resistance being applied to it in any way, then you create uncontrolled tipping. So the center of rotation is 1 to 2 millimeters apical to the center of resistance. If you move the force level up by using a power hook or power arm, as you commonly see attached to some of the brackets, or you can crimp it to your wire, you create a situation where you reduce this moment due to force. And because it gets reduced, the translatory effect shows its prominence, and you get a center of rotation which is apical to where it was before. In a classical situation, if it's right at the apex, you get control tipping, as you're aware of. And following the same pattern, you keep on moving up. At some point, you will be very close to the center of resistance. And then, as we know, we're going to translate teeth at that point. And if you keep on going further up, apply the same system, you will start creating a moment due to force, now in the opposite direction as compared to these two, because you are now above the center of resistance. Not a very convenient way of torquing the roots, but if you have an option, can be utilized to torque roots. All right, so the second method of altering tooth movement is by applying a counter moment. A counter moment is basically a moment that is applied in the opposite direction of this blue moment that you're seeing. And that is what you see in the literature being measured as moment due to couple by force. These are just some of the ways by which you can apply a couple, as we are aware of. When a wire and a bracket interact together in this manner, any of the manner, you create a moment due to couple. So for pure rotation, the MF ratio is infinity, because when you're purely rotating a tooth, you only have a moment, you don't have any force, right? For pure rotation. For uncontrolled tipping, it is 0 by 1. Why? Because you only have a force in an uncontrolled tipping. You do not have a moment due to couple to control that. For controlled tipping, it is set around 7:1, which basically means you're exerting now a substantial amount of red moment. For translation, as someone answered, yes, it is close to 10:1. And then, of course, logically, it means for root, it goes higher up. Now, the problem with this ratios is that, suppose I give you some measurements, like, let me throw some numbers. Suppose the force is 100 grams. I hope all of you can see what I'm drawing. I'm just assuming you can. And this distance is 10 millimeters. Can you tell me the MF ratio required for translation? You had 100 gram of force, 10 millimeter was the distance, that is this distance. So you calculated how the incisor is dumping. It's dumping with a moment of 1000 gram millimeter, right? So you have to basically just counteract this by this red moment here. So you know that the counter moment you'll be creating would be 1000. And then you say, okay, I need to calculate this ratio out here. So I'll just divide it by the amount of force that I'm creating. And that becomes 10:1 is the answer. That is awesome. That's correct. So let's remember this value. And now suppose I change it up a bit. I say that you're applying a force of so let's just change this variable. So it's 100 grams. And this is not an incisor. Say it's a canine. And this distance is 13 millimeters. What's your MF ratio now for translation? That is, you take the force and you say, okay, let me calculate that is dumping moment, which is 100 into 13, right? This is 13. So that gives me a force of a moment of 1300 gram millimeter of dumping moment I'm getting. That means if I counteract the dumping moment by the same amount of uprighting moment or moment due to couple, I'll create translation because I get rid of all moments. So 1300 would be that uprighting moment, this one, and I divide it by the amount of force I'm using, 100. Now I get a ratio of 13:1. All right. So previous example, I got 10:1. And this example, I got 13:1. That shows you the importance of why measuring things quantitatively in MF ratios is a bad thing. It's a wrong thing that we have created in orthodontics by putting all these values to it. Because as you can see, what defines this MF ratio is basically what's the distance of the center of resistance to the line of force. So if you got a molar, can you make a guess as to what would be the MF ratio for translation? The center of resistance is about 7 to 8 millimeters from where you would probably place a bracket. So the uprighting, the moment to force ratio becomes 8:1. Okay. If you have a canine, it's usually about 13 millimeters to 14 millimeters from where you would put a bracket. So it's 13:1. For an upper incisor, central incisor, it is about 10 millimeters. So you see all these teeth have different MF ratios in terms of altering their tooth movement. There's no simple rule, there's no simple recipe that will guide every tooth for different types of tooth movement. This all varies. And then you can imagine the anatomical variation in every tooth. A central incisor can be long or short for that matter. So the MF ratio will vary. So it's not a great idea to stick to like quantities, but it's important to remember that, yes, if I want to translate, I require a high MF ratio. That's a decent assumption. If I want to do control tipping, I don't think I'll need a very high moment to force ratio as compared to translation. And of course, if you want to do root torquing, that's just moving the root back and keeping the crown where it is, then you require even higher MF ratio. But putting a number to it makes it, it just defeats the purpose of having these ratios, because then you can easily prove that they are wrong. So that is something that I wanted to just clear up. This is just something to remember in order to distinguish MF ratios and to distinguish moment due to force and moment due to couple. A moment due to force is dependent upon the force, of course, that you're applying and its distance from the center of resistance. So it depends on the morphology of the body, right? If you're applying a force, is it very close to the center of resistance? Is it really further away? For example, if you have a canine that is very upright and you're planning on retracting it, great. You apply a force, here's the center of resistance. What if the canine was kind of having a tip, a huge tip like this, and you're applying a force like this? Okay. So in which picture do you think you will get more moment due to force, A or B? Just happened that here it is tipped. So this distance is very less, because remember, it's the perpendicular distance, while here it is much more. So this is a very obvious variation that I'm showing, but in our clinics, in our patients, all these kind of subtle variations happen all the time. Some patients, you get a lot of dumping when you're retracting the incisors. In some patients, you don't get a lot of dumping, although you follow the same protocol. Like I'm sure some of you do certain kind of wire, certain kind of chain for incisor retraction all the time, almost in 90% of the situations. But these kind of variations can introduce a lot of different outcomes of the same mechanism that you're using for space closure or moving teeth. So something to remember. A moment due to couple is not dependent on this kind of issues. That is, how much is the distance to the center of resistance, because it is basically created most of the times by two opposing forces that are equidistant from each other and are of hopefully the same magnitude. So say, for example, just imagine this to be a lower molar that is tipped, right? And you have to upright it. And you put a bracket here and you create an uprighting moment. An uprighting moment can be created by putting a force here and by putting a force here, right? So when you do that, can you tell me around what point will the molar rotate? So here, of course, we are assuming that you're creating these two forces by whichever way you are. But for this system, let's assume that only these two forces exist. So if only these two forces exist, they classically are a couple force, two equal and opposite. So when you create a couple, you're creating a moment due to couple. A moment due to couple, as the definition of couple goes, will always act around the center of resistance right here. So the tooth will spin around this point. It can spin around this point if you have a continuous wire. That means you're creating different kind of force system when you have a continuous wire in terms of friction and everything. Or you are chaining or doing something else. That is, you're not purely creating this couple. If you're purely creating a couple, it will spin around this point. So that means the root will go here and the crown will go here. Of course, if you can create a center rotation here, then you are achieving a pure torque. That is, the crown also rotates, but very less, but the root rotates a lot, right? If you create a center rotation right here. The beautiful thing about moment due to couple is that, now imagine this patient was, having this as impacted tooth, and the oral surgeon exposed just this much part of the tooth and everything else is buried inside. Now you can still put the tube here, create the same force system, and you will get a center of rotation exactly here. So it doesn't matter where you put the tube, here, 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 anywhere, you will get the same kind of tooth movement. That is around the center of resistance. So this principle itself helps you in some of your patients when they're going to periodontics or oral surgery to get exposed. They don't have to expose this central part or, or a lot of the tooth. You can just ask for them exposing this much. Or in your practice, if you are doing laser dentistry, you can use a laser to expose this much part and just put a tube and create a couple right here. And it will beautifully upright in a way that it spins around this point.
Dr. Maduro?
Yes.
I have a question. So how exactly will we be able to do such a force, only a couple on the two corners of a tube, instead of putting like extrusive or more intrusive, physically speaking?
Correct. That's a good question. So for those, in terms of if you want to purely create this kind of force system, you use something called as a one couple force systems. And I'll be showing you a lot of at least a few examples of these one couple force systems. So then a one couple force systems can be, I'm sure some of you might have used, for example, an uprighting spring. Okay. So imagine there's this, a molar with a tipped bracket attached to it. So the molar is, as I'd shown before, tipped. Now, if you have this wire, with a little hook at the end of it, you take this, you insert it. So it will be like that. And I'm imagining the rest of the teeth have an arch wire going through it, but this arch wire is not engaged in this tube. You just take this and move it up and you hook it here. So in this way, you can create a very pure couple system here. So it's just a simple design. Takes, I don't know, like 20 seconds chair time of making it. So this will create an intrusive force here, but this would be completely negated by all these teeth that you have included with a one big continuous wire. And I'll show you clinical pictures. And here you will get two forces like that. One of the forces, this one will be slightly more than this one. That will create, this force will be slightly more, the upward force, than this one. So you'll get a net extrusive movement, but you'll also get a heavy couple to upright this tooth. That brings us to from your question that you asked, it was a very timely question, because now we can easily go into differential moments. Differential moments is a concept where you create different moments. That is, as you know, as you had asked a question right now, where you said that, how can I create a moment on that molar that we were talking about? So in your treatment, you're looking at the patient and you're saying, you know what, I just want a moment on this molar and nothing anywhere else. That is what differential moments answers. It gives you the capacity to create a moment at one tooth without creating any kind of moment or any significant moment at the other tooth. That is, different moments are created at different teeth. You have the power to create same moment at two different sites, different moments, one very big moment, one very small moment, one zero moment, one a lot of moment. So you can alter the way you want to alter. So this is that example what I was trying to show, a one couple force system. It has a simple method of action where, imagine this to be an impacted canine, right? Just imagine that. And there's a bracket onto it. I take a wire, I put it in the molar tube, and I basically, I mean, of course, when I put in the molar tube, it is lying flat like this, but I stretch it, I kind of pull it up, and I engage it here. But I am tying it to the bracket. I'm not inserting the wire inside the bracket, right? The wire is only inserted inside the bracket on this tube. That is why it is known as one couple force system, because the wire will create a couple only at this bracket, okay? And what I mean by, again, by couple is that when the wire is inserted in the tube, it's going to lie somewhat like this. That's how the wire is lying. So it is touching the tube here, and it is touching the tube here. That creates this huge moment. While here, there is no 2-point contact. Like, there's no wire going like this. So there is no couple created. It is just tied here. So when it is tied, it just creates a single force as shown. So, so this is how a one couple force system works. It's one of the most predictable force system that you can create. So if this is a 20-gram force you are creating, can you tell me what will be the force here? 20 grams, okay? Because of, not because of Newton's third law, every action has got an equal and opposite reaction, but because of the principles of equilibrium, that if in a system you're creating X force here, then somewhere in the system, X force will be created in the opposite direction, because the system is in equilibrium, okay? So this is 20 gram. And based on these two forces, you can calculate how much is this moment being created, okay? If I give you this distance, that is the distance between these two is, say, 20 millimeters. I'm sticking with 20s. Maybe let's make it 30, okay, so that we don't get confused with numbers here. So imagine this is 30. Can you tell me what is the moment due to couple created at the molar tube? Will be 600 gram millimeter. So what you do is, again, you use the principle of equilibrium, which says that the sum of moments created in the system, so MA, MB, will be equal to 0. It has to be. So you know there's a moment being created here, which is the moment at the molar tube. So MA is moment at the molar tube. Plus the other moment that is being created is only being created by these two forces, right? Because these are equal and opposite. So overall, they are creating this huge moment for the whole system to spin in a way, right? And this, I know, I can calculate this moment, this huge one, which will be this force times, of course, this distance, because that's how you calculate the moment due to couple. So force times this distance gives me 600. So 600 is, so moment at the molar tube. And again, I'm talking here moment due to couples, not moment due to force. So moment at the molar tube, moment overall is 0. So moment at the molar tube comes to be minus 600. And that minus is important because it tells you that this moment is opposite to of this, because this is a positive, this is a negative. And as you see, this will be opposite to this guy, to this one that we draw. So clinically, it's very easy to calculate if you want to, that is calculate. I'm not saying you have to. Clinically, what's more important is to know the direction of this moment, so that when you are moving a canine like this, you know what are the side effects being generated on the molar tube. So the molar tube is feeling an extrusion. Again, due to the law of equilibrium, it's also experiencing a forward moment, if you want to call it that way. That is, this whole molar will tend to tip forward as we go along. And if some of you have done canine extrusion with these springs without a TPA or something, you will see that happen very quickly, this forward movement. All these moments that we discussed were moment due to couples. If you're wondering where is moment due to force, that is when you introduce those teeth structures, then you start getting moment due to force. Okay. So because this force line of action, if I assume, is like this, so it's this much away from the center of resistance, I get this moment due to force. This moment due to force has nothing to do with equilibrium or balancing your forces or anything of that sort. Okay. So this is what it is. This canine could have been absolutely straight. If it was absolutely straight, I won't get any moment due to force. So it just depends on the inherent anatomy of the tooth, as I told you before. Similarly here, if your tube was not in the correct position, it was slightly off, and this is a center of resistance, you might create a little moment due to force. But for most purposes, it's like insignificant, because normally we are dead on with this, or even if we are slightly off, it's no big deal. So the blue ones are moment due to force, the red ones are moment due to couple. All your laws of equilibrium are for these red things, not for the blue things. So that's very important, not to mix up these things when you're thinking about what is the force system being created. You can use it for canine extrusion, as we saw, molar uprighting, we did that too. For torquing, you can use it for torquing. Interestingly, there was a article in AJODO in January or February this year. There was a clinical study where they'd used a one-couple torquing system to torque lower incisors. They did like 20 patients or 15 patients. So that was interesting. They used exactly a one-couple force system to create a torque. And then, as someone said, intrusion arches, you reverse it, you get an extrusion arch. These are beautiful examples of one-couple force system. You can use the same systems to fix canted occlusal planes. I think this is really effective. Like if you use these to fix canted occlusal planes, it works super fast. And then there are some ways of using it with sliding mechanics too for space closure. All right. Now, if you take your wire and your bracket, just tying it, you insert it at both the ends, then you create a two-couple force system, right? Because now you have your wire inserted at this bracket as well as this bracket. So here you'll get a couple, and here, of course, we know we'll get a couple. So it's called as a two-couple force system. And of course, if the force is down here, the force would be up here. All right. Now, if suppose I move this bend here, what will be the direction of the force here, up or down? If you said, yeah, it will go up, yes, that's the correct answer. It will go up, right? Now, if you put a bend here like that, you have to figure out other things too, right? For example, what is the direction of moment here? And what is the direction of moment here? And then if I change my bend from here to here, then what is the direction of the moment at both the brackets? So what I'm trying to show here is that as soon as you create a two-couple system, so you have just increased, you have basically moved your appliance design complexity slightly up, and you see that things gets pretty complicated in terms of predicting what's going to happen, right? So that's why as soon as you go to two bracket systems like this, these are known as statically indeterminate force systems, in the sense you can make some educated guesses, but as soon as you start dealing with all these intricacies of moving the bend from here to here and then trying to figure out what is the moment created here and here, it gets a bit complicated. It's not that easy. So people in the past have done a lot of experiments by taking two brackets like this and saying, okay, let's do this thing. Let's put first a bend right in the middle, right here, and see what happens. So they found out certain things. Then they said, okay, let's move the bend here and see what happens. And then they said, let's put the bend here and see what happens. So on and so forth. What they found was the intensity of the bend, that is the amount of degrees of bending you are doing, does not matter. What is critical is where you are positioning the bend. Are you positioning the bend here or here or here? That is critical. Okay. Of course, if you position a bend here, these two would be same in a way. It's just that the force systems will reverse. So where you are positioning the bend from the middle of the interbracket distance to how close you want to get to this guy, the force system will change. And this is what they found. And we had discussed this at length in Biomechanics 1, but here I just have a quick summary. And this is what is the universe of putting a step bend. So these two pictures are for step bends, and the rest are for V-bends. Now, if you look at V-bends, this first picture, this V-bend is assumed to be put very close to this bracket. So when you put a V-bend very close to this bracket, you get a huge moment here. Okay. And because you get a huge moment here, the counterbalancing moment would be in the opposite direction, following the laws of equilibrium. And this counterbalancing moment results in this extrusive and intrusive force. All right. Now, when the bend is moved forward, so instead of putting a bend here in this picture, you're moving it slightly forward so that it is about 1/3 of the total distance. Then you still get a good moment here, but here you get very less moment or no moment. Okay. And when you place a bend, I'm coming to this extreme picture now, right in the middle, right here, you get equal and opposite moment. When you get equal and opposite moment at both the ends, that means if I add them up, my net moment is 0. All right. So if there is 0 net moment, there'll be no vertical forces. So there are no vertical forces produced when you place a bend exactly between two brackets. So these are just some of the interpretations that you get by playing around with two brackets and a bend in between. All right. These are known as V-bends. I'm leaving these two out for now. I'm just saying all this. These are known as V-bends, and people use it in many different ways to do different kinds of tooth movement. Examples where you can use V-bends. So V-bends are used as anchor bends. I would also regard this as very important. And as you said, that for doing any kind of TPM mechanics, I don't know if you guys are doing it for torquing or for distalization, you have to have a very good concept of how V-bends work. So this is huge. Something called as gable bends or offset bends that you might be using also uses V-bends. So they're basically two V-bends placed like this sometimes. There's a gable bend. Or when you're trying to upright teeth, then you're using, again, two V-bends. So that's one V and that's another V. So for tipped teeth, you're using that. These are all gable bends. So essentially, why it is useful to learn the first principles, that is the one couple and two couple force systems, is you don't have to individually understand how each of these things work. If you know your first principles, you can just straight away apply them and you will know how these are working. In fact, you can create your own methods or your own appliances based on these principles of V-bends. So these ground rules are very critical. Loop mechanics entirely works on the V-bend principle completely. So that is there. And then torquing systems work with that. That AJODO article that I was talking about that came out in January has used this mechanism of torquing teeth. And you can also create intrusion and extrusion, which V-bends. A very popular appliance that uses it is, I don't know if you guys use it, is called a utility arch there. So this uses a V-bend. You put a bend either here or here or here, wherever. It's all working on V-bend's principle. It all goes back to understanding this particular slide. And if you know this, how this is going as you move the bend, you can define any kind of device or appliance that you're using. And if I ask you to follow this particular moment here, so when you put a bend here, this moment is going in this direction. But when you come to this picture, it vanishes as the bend has been moved further forward. And then you come to this picture, the bend is moved further forward and the moment reappears here. But you look at the direction between the two, here and here, they're in the opposite direction. So the questions are like, what is actually going on? Like when we move these bends, how do these moments appear and reappear? So that's a good question to ask. The other questions to ask is, what happens if I increase the bends, which I kind of touched upon before, and these two bends are kind of mimicking like a premolar molar bracket or a molar canine bracket. But what happens if I have a molar bracket and I have an incisor bracket? Then how do these bends behave? So these are some of the questions that are important to understand, because if you understand them, it helps you understand actually your appliance system, that is your brackets. So if you look at this picture, this shows how two brackets would appear to you. Like if you have a clinical patient and you want to view two brackets sitting next to each other, this is how they will appear, right? But actually what is important for you is just the slots. Everything else is noise. And this slot dimensions are good to know because it helps to understand what you're dealing with. It can be anywhere from 3 to 4.5 millimeters, depending on, what you're looking at, molar tube or canine bracket or incisor bracket. And this thing that we are dealing with is the height of a slot, which is 0.022 if you're using a 2228. And we cannot see the depth here, which is 28. So what I want to emphasize is that the ratio of the length of a bracket to its height is pretty amazing. It's about 5:1, because 0.022 basically translates to about 0.55 millimeters. So so if you do the ratio between, so our brackets are actually very thin. We imagine it to be like squarish, but actually they are very thin. And this is important to know, because this creates a lot of interesting things when you put a bend in a bracket. So now imagine this to be 7 millimeters. And as I said, this is 0.022 inch. So when you put a wire right in the middle of the two brackets, you see how the wire is touching the corners of the bracket right here and here. So this is what creates two equal and opposite moments, right? Now, when you move a bend here, slightly off to one of the brackets, and if this is 1/3 the distance, what is happening here? This is interesting to note. What is happening on the other side is that the wire is only touching one part of the bracket, not touching this part. So what happens is, even if you put a V-bend, it doesn't matter how much degrees you put, here, it's not creating a moment. It is just creating a pure force. Okay. So, however, on the other side, yes, you get a very strong moment. All right. Now I can keep on going this way and move the bend even further towards that bracket. So when I do that, when I put a bend here, something interesting happens here. The wire, because of its flexibility, recurves, right? And when it recurves, it starts creating this moment. It is not that big. I've just drawn it big. But this is the much bigger moment. But here also you start getting this little moment, okay? So when you put a bend super close to one bracket, this bracket will have a huge moment, but then you might get some moment even here too, okay? So this is interesting to note. Now, things change a bit if I replace this bracket with an incisor bracket. This is how it will look if I do that. So instead of this bracket, I have this, all right? And if I draw it to exact scale, that is how they will look. Like if I take a clinical picture and try to represent it on a slide, that is how they will actually look. So now, when you have a bend that is placed like this, there is a complete set of different interactions happening here, because now this is not in the so-called second order. Like the bracket is not like this. It is just this, right? So what was previously your length, on an incisor, it becomes your depth. So this changes your geometries a lot. And this is what I mean by that. So let me clear this off. Yeah. So what we were previously doing was that we had these two slots like that. Now, if I place a V-bend between these two, we know that it's going to create equal and opposite moment. But if I replace it with an incisor bracket like that, as you can see here, it is not in a position to create a couple. There's no way a couple being produced here. Because for a couple to produce, this and this have to touch. And it's not touching here, okay? And this can be seen in a little picture here, which because we run a lot of these experiments, this is how the bracket and wire look if a bend is placed here, right? It is just sitting on the roof. So there's just a single force that this wire is producing. Even though if you had a molar and a canine bracket, it would produce a couple, this same V-bend. It will produce a couple here, but here it does not. And this is an important point from a clinical application perspective. So what do you need to do? It's a question. What do you need to do to create a couple here? What would you do? If I transition from here and I take the bend forward there, like that, now you start getting this contact here and here. So the moral of the story is that if you put a bend closer to the incisor, that is only when you start getting some kind of torque here, okay? And the whole reason why we have to go so much close to the incisor is because the second order arrangement gets you easy torque. But when you're dealing with incisor brackets, which have relatively bigger this dimension and shorter this dimension, you'll have to angulate the wire a lot to get the same couple, right? So there's a lot of difference between the two. So the bends have to be moved much closer to the incisor bracket to get a good torque. So that is key. And that straight away ties into some of the wires that we get. So when you put a curve of speed wire, and if you are putting it with the assumption that this curve in the front here will create a flaring effect or a torquing effect, you know, that will cause some flaring, it won't do that. Because if you look at this, and if I join the two ends of the wire, a bend is occurring here, while my incisor bracket is here actually. I have to make sure that this is moved somewhere here. And the only way you can do that is by modifying your curve of speed wires. That is, if you flatten out the ends, now you look at this. Now you have moved your bend previously from here to here. So just by, suppose you're dealing with a clinical patient, a Div 2, and you want this rapid flaring of your front teeth, a good idea would be to just flatten out your curve of P wires at the posterior end. A little trick can get you that flaring much quicker and much faster, as opposed to just kind of, blindly going with a custom, with a set wire. Customizing it really helps. So that is one example of that. Now, of course, if we move this bend closer to the molar, the front teeth don't feel anything in terms of a couple at all. So this configuration is a safe bet. If you want to create, as somebody was saying, somebody correctly answered when they said that we use a V-bend to create, to reinforce anchorage. So this can be a good way of creating a lot of moment here, but hardly any moment here, so that you can let this incisor go as you please. In terms, if you want tipping, it will still undergo a considerable amount of tipping. So this location of V-bend becomes very, very critical. All right. Some of the questions that we always had as we dug deeper into these things was that which type of wire should we use, how much bends to place, and so on and so forth. We ran a series of experiments in which we simulated a molar and an incisor bracket, and we put a lot of bends with different wires at different positions to see what kind of force and moments are we getting. So we kept on shifting our bends from this position to this, to this, to this, and we tried different angles. We went 15 degrees, we went 20 degrees, we went 30 degrees. And we had different sizes of wires, right from 2125 to 1622. And we just wanted to see what is going on actually. These are just different positions of bends that we tried. Now, this is not putting all the bends out at once. Like one wire, we put a bend here, one wire, we put a bend here, one wire, we put a bend here. So different wires are different bends, but we just tried every possible position to see what we are getting. And well, we got a lot of stuff. We got a lot of graphs. I won't go very deep into these graphs. I'll just come to the point. So this is like a summary graph of everything. So you can imagine we tested like 4 different sizes of wires. Then we tested 2 or 3 different varieties of wires. Then we tested 3 or 4 different angulations, right from 10, 12, 15, 30 degrees. This is a summary because what we observed, the pattern was strikingly similar. The quantities varied, but the pattern was very, very similar. So if you imagine this to be a molar tube and this to be your incisor, and this is the interbracket span, right? So when I put a bend on this dot, it is super close to the incisor. So I get a huge amount of this blue line, which is the incisor moment. And also I'm getting a huge amount of moment at the molar. But because they are both in the positive side of the graph, they are in the same direction. Okay. Now, if I put a bend here, and this is the interesting one, so I'll just confine my answer to this. Anywhere here, so you see that mesial to the molar up till this was approximately, keep on going, about 15 millimeters for sure. So if you're putting a bend anywhere from molar till 15 millimeters mesial, look at this blue line. The blue line tells you the incisor moment value. It is 0. So if you had a wire and you are bending it like crazy, like that, and this bend was somewhere in this region, you are not producing any kind of this moment at the incisor. It's 0. And we tried it with a 2125 shoved in with a 30-degree bend placed here and 0. Okay, or very less. Experiments do give you some values here or there, or very less. So that was super interesting for us to look. All right. So what we finally got out of it was these three classes, and I'll go one by one. So this is the one that I discussed with you. So if you have a molar here, if you have an incisor here, and you place a bend anywhere in this region, okay, this whole span is approximately 30 millimeters. So if you're anywhere in this region, anywhere you place a bend, you don't get a moment here. All right. It happened because these experiments we kept on doing for 3 or 4 years. We in the clinic, we were kind of, using them just to see what we get in pure system. So here's a patient, is one of my patients who came in pretty early. Normally we don't do a lot of early treatment, but we were like, okay, we'll put the braces on for 2 or 3 months and then, get rid of them. So our objective was, let's tip this molar back and if possible, create some space in that process and get a class 1, and then we are done. Okay. And of course we knew that normal leveling aligning with a NiTi will create some kind of leveling aligning or straightening of the teeth here. So we went ahead, we leveled and aligned a little bit, and then with a 1725 steel, as you can see, put a bend right here, super close to the molar tube, because we wanted this. We wanted to tip this molar back, create some room for easy eruption of teeth, and at the same time, if we can create a class 1, why not? So that is what we did. And as you can see, we got some intrusion here, which works for us. We don't mind that at all. And we got some good tip back here. So that fixed that problem. It was basically in for barely 2 to 3 months. And then we put the patient on a Holly retainer just to retain these corrections. So pretty useful. I don't know if you guys have come across some of the literature by Thomas F. Mulligan. It's published as a series in JCO. He uses a lot of this, or used to use, I guess he's retired. A lot of these techniques to treat his early phase or very young patients, because in early treatment you don't have access as such to these teeth because they are still erupting. So you have basically a 2x4 setup. So you can solve a lot of problems very easily in that way. So this is one you can say class of bends, which is anywhere here you get the same force system. The second class can be defined as, now if you move the bend from the midline, so if this was my 15 millimeters from here, now if I go further forward, in about this much region, which will be like 5 to 6 millimeters, I hit a situation where you see the moments are kind of equal and opposite. Okay. And there are some vertical forces created, but not a lot. So this is like the sweet spot. If you put a V bend here, you get maybe something here, you get maybe something here. All right. And that is where we sometimes use our curve of P, right? In that way, and which I talked about, that if you put a curve of P like that, maybe you'll get some moment, maybe not, but you won't get a lot. This is very small value. So maybe it is a lot, maybe not. If you want to create a bigger effect, then as I told, you need to flatten these ends out. So make it flat, and then you get a bigger effect. And of course, as we were talking about, if you want to really torque these incisors, then you move the bend further forward. Okay. So when you move the bend further forward, now you create a huge couple here and you get a big torquing effect. The interesting thing we saw was that when you get a huge torquing effect here the moment is also produced, but it is in the same direction as this. So basically, your molar feels a slightly tip forward effect. Okay, like that. All right. So that is pretty interesting thing to observe. And this is how the picture looks in our experiment. You see how the bend is super close to the incisor, and you see this coupling that is happening here. I've of course joined 2 images, so this is not representing the actual span. And here you maybe get a slight moment in the same direction. Maybe not. It's not necessary you will. So if you're in this region only, that's when you get a huge torque on your incisor. So can anybody, by looking at this picture, say what this configuration would be useful for. So we use this a lot for molar protraction, a lot, like non-TAD based. We do a lot of non-TAD based molar protractions. And we use this situation because that's what we learned from all this research, that you can create so much moment here that the anchor loss is minimal, or at times nothing, zero. So you see a big moment here. So when you have a chain going from here to the molar, I'll show you a clinical example too, so that you get the full picture as to how it's happening. So a force is like this, pulling the molar, force like that. So this force causes the incisors to actually dump, right? They'll dump like this. So this moment is completely negated by this. As a first principle rule, it's very important to remember anchor loss happens due to tipping. It never happens due to translation, at least in the first couple of months. So if you can control your tipping moments, you can win over anchorage. And that's a first principle rule. It cannot be violated. So this is the moment that you want to take. This is the moment here that you want to take care of, this dumping. And so this does it very effectively. Here, this works in our favor because it gives us this initial nudge for the molar to go forward. So that is pretty useful. And then, of course, the molar is going to walk on the wire. But it's a good system to start with. It can also help in anterior crossbites also. That's another application that we have used it. A quick clinical example to show the same. This is one of my patients from my practice. They were twin brothers actually. And this picture I took in centric relation. In centric occlusion, this patient was a full class 3. So when I saw this, we imagined that, oh yeah, if I can just, torque these teeth slightly forward and maybe extrude them, I should be fine. So what did we do? We had these two brackets, thought, let's place a bend as close as possible. So what this did for me is exactly the force system shown here. Create this huge flaring. And because this is a big moment here, my vertical forces will create a counter moment in the system, which will be expressed in the form of extrusion in the front and intrusion in the back. So this is, I call a fail-safe super appliance, because even the side effects, which is extrusion here and intrusion here, is favorable for you. So you don't mind it to keep on working for you. This is the intermediate picture when he started automatically positioning his bite correctly as soon as the teeth started flaring, and then finally debanded. It took about 7 months to 8 months to get to this position. Incidentally, this patient I've always kept on retention check. He's now 17 years old and he doesn't need braces. So at this point, I think at this point it was interesting when the patient came to us, because remember, this is centric relation. So in centric occlusion, he was full class 3. He had been suggested in the future might require surgery or face mask or zygomatic anchorage for a face mask. But he didn't get any. In fact, he didn't even get braces more than 6 months. So sometimes it's just so interesting to see these patients evolve. All right. So in summary, this is what we got in terms of, if you want to just remember, like out of all this work, like what should I take away? This is the slide that I would take away. And we tried to write this down in a clinically applicable manner, in the sense we didn't want to attach a lot of numbers to it. And if you want to make it even much more streamlined, remembering the first and the third is perhaps the key, because these are just the opposite, right? If you look at them. The middle one is okay, but this is what has got a lot of, for us, definitely a lot of clinical application. In terms of the amount of time that I bending a V-bend is like what, 1 second or 2 seconds, and it does so many different things. So the summary of V-bend interactions in one slide, if you want to look at it that way, that is what it is. This is molar incisor. This is you can say molar premolar, molar canine, any second order interaction. So by second order, I mean when you look at a bracket in this way and a wire is interacting like that, this is a second order interaction. So these are the rules for a second order interaction. And these are the rules for a second, and this is known as a third order. So second and a third order interaction. So this kind of encapsulates the whole idea about how to use V-bends.